Cerebellar atrophy is a condition often genetic amongst many factors that arise from damage to the cerebellum, the part of the brain that plays an important role in motor coordination, balance, posture maintenance, vision, learning, and memory. The most common symptoms include a balance disorder and motor condition. Many scales exist for cerebellar atrophy, the most common of which is the scale for assessment and rating of ataxia.
The most common way to measure the degree of one's level of ataxia based on cerebellar atrophy is through the Scale for Assessment and Rating of Ataxia score, which evaluates 8 ataxia-affected abilities: gait, stance, sitting, speech disturbance, finger chase, nose-finger test, fast alternating hand movement, heel shin slide, to produce a composite score. This experimental method is used in most clinical trials of patients with ataxia due to cerebellar disease. However, quantifying the results can be difficult because it is purely based off of the doctor's assessment. To solve this problem, we developed the Sara-Q system.
Before we get into the tests, these are our two main pages that are very necessary for the functionality of our app, as well as ensuring that the data that our app collects is accurate. So the patient information page will hold all of the patient's personal information as well as their medical details, and the test results analysis page will hold all of the patient's results from past assessments. For the touching objects test, the patient will interact with a mobile screen on which targets will appear one after another. The patient is expected to tap all the targets in the right spots and in the shortest time they can. Their speed as well as accuracy is recorded and processed into assessment data.
Our sixth test is the nose finger test, which in Sara-Q will be the line drawing test. By having the patient draw a line from one fixed point to another, we can determine the patient's level of motor control based on deviation area analysis, reverse movement analysis, discontinuity analysis, beyond analysis, turn number and maximum and average turn amplitude analysis, and modulation speed analysis.
And so starting off with our touch related test, we have this function right here, random chords, which basically returns a 2D vector with random coordinates just to make sure that each target is placed in a random spot around the screen. We make sure to factor in an offset variable that basically makes sure that the new target is a good distance away from where the previous target was. And so moving on to our touch draw test, basically how this works is that anytime the user is pressing their finger on the screen, the game will process that and it will instantiate an object where the user is pressing their finger. And basically when they're dragging their finger along, that object will follow, basically creating the visual of a line.
Recently, the FDA denied trililazole from Biohaven because there was not enough data to support the efficacy of trililazole. Sara-Q can help to overturn the FDA's decision to deny the NDA by providing data to support the efficacy and safety of trililazole and many other treatments. Compared to before, Sara-Q is an app that will allow for more accurate quantitative and objective data in a much more simple fashion, which we hope will bring more innovation to the field of cerebellar atrophy.